how do you determine the due date? I feel like you walk into the doctor's like, April 17th, that's when you're due. And you're like, wait, how do you know that?
Yeah, so the due date's usually, determined by the first day of the patient's last period, right? So we always ask, when's the first day of your last period? There's different calculations. People like to use certain calculators on their phones, or we can use, the old method of, subtract 3 months, add 7 days, and that's usually the due date of the patient.
Subtract 3 months, add 7 days.
Add 7 days. Depending on where it is, you have to change the year also.
Okay. So we often hear about the nausea and the fatigue associated with pregnancy. These aren't fun. So what other symptoms might the mother feel during that first trimester? What do you explain to them?
So they're always going to feel different. They're going to feel a little bloated, soreness, tenderness, the fatigue. You're going to have breast tenderness. You're going to have the nausea, obviously, the vomiting, depending on the hormones. And so those, the loss of appetite. Some patients won't be too hungry, and so it just depends on how that particular pregnancy is developing for that patient and how she's feeling.
So what causes these symptoms? I think you and I were talking before. My 2 pregnancies were so different. With the first one, I was very nauseous. Peanut butter and jelly and ginger dressing only helped. The second pregnancy, it was nausea and vomiting, and the only thing that helped was fast food restaurants because I needed to ease that nausea. I was dying. So what causes this?
So it's basically the hormonal changes that occur throughout the pregnancy. You have HCG, human gonadotropin hormone, the estrogen, the progesterone in the body. It all changes, and so those, depending on the levels throughout the pregnancy, those will give you some nausea and vomiting, and so those are the changes that occur throughout the early part of the pregnancy.